He was only 17 years old and had 232 teeth. No, you didn't hear that wrong. 232 teeth inside the mouth of a single teenager. It was as if a nightmare had come to life inside Ashik Gavai's jaw. The pain started subtly, throbbing, almost shy, but within weeks, it transformed his right cheek into a hard, swollen, living mass, as if something were trying to escape from inside. Ashik lived in Buldana, a humble village in the state of Maharashtra, India. But it was in June 2014, at a hospital in Mumbai, that his story crossed the line from reality into the unbelievable. His father took him there after visiting several local doctors who had no answers. "I've never seen anything like this in my life," said the chief surgeon upon seeing the X-ray for the first time. Inside that deformed jaw was a tumor that defied everything modern medicine knew. A tooth-covered, silent, monstrous creature. And what happened in the operating room that day was described by the doctors themselves as an archaeological discovery inside the human body. If stories like this fascinate you, subscribe now to the Medical Mystery Files channel. But brace yourself. What you're about to hear is real. It's terrifying. And it will make you think twice before complaining about a simple toothache. At first, no one was worried. It was just a little pain in the back of the mouth, something any dentist could treat with a cleaning or, at most, an antibiotic. But Ashik Gavai's face began to change. At 17, he no longer smiled in photos. At school, he avoided looking at his classmates. His right cheek was swelling slowly but steadily, and it didn't feel like a typical abscess. It was hard, firm, and it hurt. A strange, deep pain, as if it came from the bone itself. In the small village of Buldana, medical resources were limited. The first diagnoses failed. One dentist said it was an infection. Another claimed it was a deep cavity. They prescribed painkillers, applied ointments. Nothing worked. Ashik's father, Mr. Vilas Gavai, watched his son suffering with growing concern. He started losing weight. He wasn't sleeping well. And he seemed afraid of his own body. One morning, his mother tried to get him to smile. He refused. When she insisted, Ashik finally opened his mouth. And what she saw made her blood run cold. There were too many teeth, several overlapping, some growing at strange angles, like spikes pointing inward, and a bony protrusion pushing the gum outward, almost tearing through the lip from the inside. In that moment, the family knew this wasn't normal. They boarded a train to Mumbai, nearly 500 kilometers away, in search of a hospital that would take the case. They went straight to JJ Hospital, one of the largest public medical centers in the city. The receptionist fell silent when Ashik walked in. It wasn't the swelling, it was the look in his eyes, a tired gaze as if he already knew something bizarre was growing inside him. Doctors referred him to the Department of Oral and Maxillofacial Surgery. That's when Dr. Sunanda Diwari, head of the unit, stepped in. He seemed calm, but there was something unsettling in the air, she recalled later. Ashik didn't speak much. He sat with his hands in his lap, eyes lowered, as if afraid that any movement might wake whatever was sleeping inside his jaw. They performed an X-ray, then a CT scan. And that was the moment the doctors stopped treating the case as something simple, because what they saw looked like something out of a science fiction film. Inside the lower jaw, a compact mass filled with white spots, as if teeth, many teeth, were accumulating there in layers like scales. The medical team gathered in silence. Someone whispered, "Odontoma?" Another replied, "I've never seen one like this. Never. This is a monster." Ashik, sitting just outside, had no idea what was coming. But inside that room, experienced doctors were about to face what would be described as the most extraordinary case in modern dentistry. And what they would discover when they opened that jaw would shock the entire world. When the scans were placed on the light box, silence took over the room. None of the professionals present dared to make a joke. Even among seasoned colleagues, it was deeply disturbing. Ashik's skull appeared to contain layers. Layers of teeth, as if someone had poured a rain of teeth inside his jaw. Dr. Sunanda Diwari squinted at the images. This wasn't just a case of an extra tooth. It was a mutation, a phenomenon. She called in 2 more specialists. They came from other wings of the hospital, leaving patients and meetings behind. Everyone wanted to see it with their own eyes. The report came back with a single term: compound odontoma. In simple terms, a benign tumor made up of dental tissue. But in this case, it was almost as if the tumor had gone mad. Odontomas typically contain at most 10 or 20 tooth-like structures. Ashik had far more. The images suggested dozens, maybe hundreds. It's as if his body was generating teeth non-stop, as if it forgot how to say enough, one of the doctors explained. For the team, the dilemma was urgent: operate immediately or wait for more tests. Because the mass wasn't just strange, it was growing, fast. In the corridors of JJ Hospital, whispers began to spread. Did you see the boy with 100 teeth? They say it's not 100, it's over 200. But for Ashik, inside that room, everything was quiet. He felt like an island surrounded by stairs. Everyone wanted to know what he was, not how he felt. His father, tirelessly by his bedside, tried to comfort him. "It'll pass, son. They're going to help you." Ashik simply nodded, but his eyes said something else. He wasn't afraid of the pain. He was afraid of what the doctors might find. The decision came on a muggy June morning. The tumor had to be removed, immediately. The surgery would be delicate. No one had ever attempted to extract a dental mass of this magnitude in that location. A single wrong incision could damage critical nerves, cause facial paralysis, or worse, a deadly infection. Still, there was a sense of urgency no one could ignore. Ashik's cheek was visibly deformed. His jaw was under intense internal pressure. Time was the enemy. As the team prepared the surgical room, the instruments, the anesthesia, Ashik stared out the window. Outside, the world went on as normal. But inside, something was waiting to be removed, something that should never have been there. The night before the procedure, the chief surgeon entered the room. "Tomorrow we'll take care of this, okay?" Ashik asked in a low voice. "Will it hurt?" The doctor hesitated, then replied, "Not more than it already does." At 8:02 the next morning, Ashik was taken to the operating room. As the machines came to life and the sedative took effect, the tumor waited to be discovered, waited to be defeated. But no one, absolutely no one, was prepared for what was coming. Because when they opened that jaw, what the doctors found was something even medical textbooks dared not describe. The incision was made with surgical precision, a long, curved cut along the lower jawline. The team stood in absolute silence. Every breath felt measured. Every second timed to perfection. As the scalpel carved its path, what had been hidden began to emerge, and no one in the room could hide their reaction. This wasn't a typical tumor. It was a compact, whitish mass, incredibly dense. It looked like coral. A living, calcified structure where dozens, then hundreds, of tiny teeth were clustered like deformed pearls in a bony cocoon. Dr. Sunanda Diware, leading the surgery, nearly paused for a moment. It was like excavating a mine. With every layer we removed, more teeth appeared. Teeth with roots. Teeth with crowns. Teeth with enamel. Perfect teeth. But there were also strange ones. Malformed like twisted blades. Misshapen, curled inward like claws. During the procedure they used forceps, pliers, curettes. Every fragment was separated, counted, placed in steel trays. The metallic clinking of the instruments against the teeth echoed through the room. It was hypnotic, terrifying and fascinating at the same time, one of the assistants later said. With time, the operation stopped feeling like a surgery. It became an excavation. They kept removing, and the teeth just kept coming. It was as if Ashik's jaw had become a malfunctioning factory. A jammed biological mechanism, spitting out dental structures non-stop, senselessly, without rest. It took 7 surgeons, 2 nurses, and nearly 7 continuous hours of work. When the final fragment was removed, the official count was announced: 232 teeth. It wasn't just a record, it was a biological aberration. A number so absurd that the doctors had to count several times before they could believe it. But the most shocking part wasn't the quantity. It was the fact that many of those teeth were arranged in layers, as if the tumor had intent, as if it knew what it was doing. Later, specialists explained it was a complex compound odontoma, an extremely rare benign tumor that replicates dental tissue. But this one went far beyond any case ever documented. Most odontomas contain 10 to 40 denticles. Ashik had nearly 10 times that amount. When the surgery ended, the room was drained. There was sweat, fatigue, but also a reverent silence. Everyone knew they had been part of something historic. The material was documented, photographed, and sent for analysis. The images would spread across the world. They'd be published in newspapers, medical journals, television programs. But there, lying on the gurney, anesthetized, his mouth stitched from the inside, Ashik still didn't know what had come out of him. He still didn't know the weight of the monster he had carried. Only the next morning, as he woke up and tried to speak for the first time, he felt it. The pain was different. It was the pain of emptiness, of absence, but also of relief. The nightmare had a name. It had a shape. It had teeth. And now, it was gone. The room was cold, not from the air conditioning, but from the tension. It felt like standing before a puzzle crafted by a deranged sculptor. Ashik Gavai's surgery wasn't just an operation. It was a battle, a silent war between the possible and the impossible, fought with scalpels and forceps instead of swords. Within minutes, the doctors realized this wasn't a routine extraction. It was a surgical excavation. Each tooth was rooted in its own bony capsule. It had to be removed with extreme precision to avoid fracturing the jaw or damaging the major nerves. One wrong move, and Ashik could lose his ability to speak, or permanently lose movement in his mouth. It was like pulling glass teeth out of a living wall, one of the surgeons recalled. With every new cavity opened, more teeth appeared, clustered, entangled, fused together like creatures from an anatomical nightmare. Unconventional tools had to be used. At one point, they adapted a mini dental drill to break through a bone capsule without damaging the surrounding roots. There was tension, there was sweat, there was fatigue, but more than anything, there was a shared determination to free that boy from the monster that had grown inside his mouth for years. The procedure lasted nearly 7 hours. 7 hours with hands deep inside a toothed tumor. With each extracted tooth, the count was logged with surgical precision. 1, 12, 37, 84. When they passed 150, the room went quiet. No one spoke. No one celebrated. It was too soon. When the final count reached 232, a strange hush fell over the room. No one dared say it out loud, but everyone felt it. This would never be repeated, never be surpassed. Dr. Sunanda, exhausted, pulled off her gloves with a dry snap. "It's over," she said. "The strangest thing I've ever seen came out of that boy's body." The teeth were placed in trays, photographed, catalogued. Some were just millimeters long. Others were sharp, long, almost beast-like. The material was sent for analysis and also for submission to the Limca Book of Records, India's version of the Guinness World Records. It was official. Ashik Gavai was now the human being with the most teeth ever removed in a single surgery. But victory came at a price. Recovery would be slow. The surgery had exposed part of his jawbone. The risk of infection was real. The pain would be intense, and Ashik would have to relearn how to chew. In the following days, he remained under observation. He didn't speak much, but he smiled. Still swollen, still healing, he smiled. This time it was a real smile, his father said. Outside the hospital, journalists were already waiting. They wanted photos, headlines, but Ashik didn't want fame. He just wanted peace. He wanted to eat without pain, to sleep without fear, to smile without thinking. The battle was over. The monster was defeated. But the impact, that was just beginning. Because the world was about to learn the story of the boy with 232 teeth. And what it revealed about the deepest mysteries of the human body. When Ashik woke up the morning after the surgery, his face was still numb, but something had changed. Something he couldn't quite explain until he looked in the mirror. That cheek that had been growing for months, heavy, painful, disfigured, was gone. The mass had vanished. The weight had lifted. For the first time in a long while, the outline of his face looked human again. Familiar. He slowly ran his fingers along his jawline, feeling the internal stitches. It hurt. Of course it did. But it was a different kind of pain. The pain of healing. At the hospital, doctors came to visit Ashik's room one by one. Some brought charts. Others just wanted to see him. "You're living history," they said. But Ashik didn't see himself that way. Not as a phenomenon. Not as a celebrity. Just as a boy who wanted to eat rice and curry without feeling like the world was collapsing inside his mouth. Recovery was cautious. For 2 weeks he was on a liquid diet. Then, soft purees. Over time, he relearned how to chew, how to control the muscles in his jaw. Small movements, small victories. The doctors took turns giving interviews. The media called the case one of a kind in history. Images of the trays filled with teeth went viral. They became a symbol of a body that had created a monster inside itself, and won. But for Ashik, the most unforgettable moment wasn't when he heard the number 232. It was when, alone in his room, he looked in the mirror, forced a gentle smile. And for the first time in months, didn't feel pain. He cried, not from suffering, but from relief. Because now he could be himself again. No more curious stares, no more looks of disgust, no more fear of opening his mouth. In the village of Buldana, where it all began, word spread quickly. Me, the boy with the swelling. The strange boy. Me at C4. Leah was now the boy who survived the impossible. He, the boy who beat 232 teeth. His father, Mr. Velas, was the most emotional of all. For months, I watched my son disappear. Now he's back. Ashik returned home weeks later, still with restrictions, still under supervision, but with something no medical scan could detect: hope. Neighbors welcomed him back with a celebration. Some were shy, others applauded. And for the first time in a long while, he smiled. A smile with fewer teeth, but with more truth. Today, Ashik Gavai is remembered by doctors around the world as the boy with 232 teeth. But to those who truly knew him, he's just Ashik, a quiet, kind teenager who faced the impossible with silent courage, and won. Most of us have between 28 and 32 teeth. Some a little more, others a little less. But no one, absolutely no one, is prepared to hear they have 232. Ashik Gavai didn't choose to carry that mark. He didn't ask to be an anomaly. He never wanted to make headlines. He just wanted to live without pain, to eat without fear, to smile without hiding. But sometimes, the human body forgets to follow the script. Inside Ashik's jaw, something went wrong. Cells meant to form a single molar multiplied like an army without command, and created a silent creature, made of teeth, that grew inside him like an unspeakable secret. Medicine still tries to understand exactly why, but maybe the more important question isn't that. Maybe the real question is, what would you do if this happened to you? If one day you looked in the mirror and your face was no longer the same? If doctors shook their heads, confused, with no answers? If your body suddenly chose a path even science couldn't explain? Ashik survived, but what he went through challenges more than just medical logic. It challenges our very idea of what is normal, because inside each of us is a complex, fragile, and sometimes unpredictable organism. This case isn't just about teeth. It's about fear, courage, isolation, and about a boy who faced his own body and came out victorious. And the next time you feel something strange, something small that seems silly, remember Ashik, because sometimes the smallest pain hides the most unthinkable secret. If this story moved you, if it made you reflect, if it made you look in the mirror with new eyes, subscribe now to the Medical Mystery Files channel. Medicine still holds secrets you need to uncover, and deep down, somewhere inside every one of us, there just might be a tooth waiting to be born.